most importantly, the gym men, it's just again a myth that those who have bulky muscle, huge bodies, absolutely, it is not directly proportional. The size of their organ may not be reflective of their muscle sizes. So today I am going to talk about penile dysmorphia, whether it is a myth or reality. I would say it is both, myth as well as reality, because in certain situations it is quite disturbing for the affected individual. So thank you for those kind words. We all are aware that the penis, I would say rather, no two penis have exact same dimensions. Every one of us have just like we have a unique fingerprint, every one of us might have an unique penis. No two penis are of same size and dimensions. The penis in its erect state is a symbol of masculinity. In many cultures, it symbolizes the attributes such as largeness, strength, endurance, ability, courage, intelligence, knowledge, dominance over other men, possession of women, a symbol of loving and being loved. Some concepts date back to thousands of years, right from the caveman times. The Indian sadhus, particularly in the Gangetic belt, they use weights to increase the dimensions of their penis. Dayak men in Borneo, Indonesia, piercing the glands and inserting items into the resultant holes to stimulate their partners. Tupinamba of Brazil, one of the tribes in the Brazilian rainforest, encourage the bites with poisonous snakes, which induce swelling to the glands and make it appear bigger. Prehistoric cave dwellers attributed the symbolic values of strength and power to penile size, as well as virility and fertility, also recommended in Kama Sutra. It is no surprise, even today, men place great importance on the size of the penis. Now, hegemonic masculinity is defined by attributes such as physical strength, heterosexuality with authority over women and other men, no emotions, economic independence, and ability to demonstrate sexual conquest. Society supports the hegemonic masculinity within the most of its institutions. It is all subtle and it is part of our behavior. We have accepted it. It is more surprising that when men are concerned about their penile size, this concern relates not only to the erect but also to the flaccid penis. Many times the flaccid penis appears small, or you can label it small, but it is normal. But when there is an erection, that is absolutely fine. Still, the men, they are concerned about their flaccid length. And many people, when they consult in the clinic, they say, "Sir, ऐसा लगता है मर गया है, कुछ है ही नहीं." This is a very common statement from the patients. It is more, man can go to extreme lengths to try to change the size of his penis. It can become an obsessive compulsive disorder and part of a general body dysmorphic disorder. SPS is found in men with normal sized penis but who are anxious about the size of penis, in contrast to men who have truly small penis. In my 12 years of practice, I have come across 3 cases of micro penis and small penis. I think even an 8-inch, I had a patient who had an erect length of 8 inches and yet he wanted a bigger one because he was obsessed with the size of a donkey's or a horse penis. So that extreme thought process is part and parcel of our obsession with penis size. It is relevant to note that while men with a larger penis in length and circumference have better body image, genital image and feeling of greater sexual competence, Women do not necessarily believe that a larger penis is better, but there are exceptions. One particular case where I remember both the husband and wife, it was a second marriage, and the person had a wonderful erection. It was almost 6 inches in the length, normal girth. Yet the female complained that, no, this is like bachcha, ye bacche jaisa hai, this is not what I expected. On dwelling deeper, her first husband had a very well-endowed organ and they used to have a great sex. She divorced her because he was mama's boy. And now she has married this man, but he is falling short of her expectation of an organ. So size matters for certain women, but it is not generalizable. The issue of attractiveness to women is complex, as we all know. Penile size is much lower in the list of priorities for women than a man's personality and external grooming. So this is what it is all about, measuring tape. Invariably, I do this measuring tape at least 4 or 5 times in a week. And most importantly, the gym men, it's just again a myth that those who have bulky muscle, huge bodies, absolutely, it is not directly proportional. The size of their organ may not be reflective of their muscle sizes. Penile dysmorphic disorder, men diagnosed with body dysmorphic disorder in whom the size or shape of penis is their main preoccupation, causing significant shame or handicap. There are no specific measures for identifying men with penile dysmorphic disorder compared to men who are anxious about the size of their penis but do not have. Such a measure is helpful for treatment planning, reducing unrealistic expectations, measuring outcome after any psychological or physical intervention. Penis size shame is found in men who have a normal sized penis but experience shame about its size. So it's, this and that. Corollary is also true. The medical definition excludes men who have micropenis, which is less than 7.5 centimeter in erect length or 4 centimeter in flaccid state. And small penis syndrome is an anxiety about the genitals being observed directly or indirectly because of the concern that the flaccid length or girth is less than the normal for an adult male. It might be an obsessive rumination. Degree of emotional distress and behavioral impairment is quite obvious. Often the penile size is not overtly acknowledged issue and situational or context driven. There is embarrassment and fear of being scrutinized by friends, peers. So there is a kind of socially isolated behavior which is evident in such patients. As victims of poor self-image, these individuals do not show sufficient social skills, are single or divorced. Most men rated their penis as average in a large internet-based survey of almost 52,000 men. Self-reported penile size was correlated positively with height and negatively with body fat level. So buried penis is one of the reasons for a normal sized penis becoming small. About 85% of women were satisfied with their partner's penile size. Only 55% men were satisfied and 45% men wanting to be larger. Most women who reported their partner's penis as small were not satisfied. So when a woman complains, most of the times it's a genuine concern or some wrong ideas, rarely. Men reporting a larger than average penis also rated their appearance favorably. The men's more general body image influenced their estimates of penis size. So scale for objective analysis, which is developed, is beliefs about the penis size scale, BAPS. It's a 10-item. Initially it was an 18-item scale. Then after figuring out the relevant questionnaire, they came to a 10-point scale which had a good internal consistency and correlated significantly with measures of depression, anxiety, body image, quality of life, social anxiety, erectile function, overall satisfaction, importance attached to penis size. The BAPS was not found to correlate with actual penis size, able to discriminate between those who had concern or were dissatisfied with their penis size and who were not. It measures the various manifestations of masculinity, internal self-evaluative beliefs, negative self-evaluation by others, anticipated consequences, and extreme self-consciousness. So what is a normal size penis, which we all should be aware of by and large, and this has been published, and it's a review of 15,000 men. The racial factors do have an impact, and they were not mentioned in the paper. The average flaccid length is 3.6 inches, circumference is 3.7 inches, stretch length is 5.2 inches, erect length is 5.1 inches, erect circumference is 4.5 inches, stretch penile length correlate highly with erect penile length, provide an useful tool in clinical practice to illustrate the range variation in penile size. From India, there was one paper published from Kerala, and the subjects, number of people they examined or evaluated were limited, and it is not generalizable to a vast and diverse country like India. So we lack data in this particular regard. So this is how to measure. Usually what there is self-measurement is very common. Almost every man measures his penis dimensions. So the correct way to measure, which I do in my practice, is, from the root of the penis, taking care that I just press appropriately and negate the effect of suprapubic fat to the tip of the penis. That is the correct way. And about circumference, I usually take into account the mid-shaft circumference, though sometimes the prepucial circumference also has an important role. So these are the various papers published across the geographies about penile dimensions. Etiology. Early observations in when a child is young, and obviously a 4 or 5-year-old boy, 6-year-old boy, 8-year-old boy observes the genitals of his elder brother or of older friend or father, the size is going to be bigger. So this boy, it stucks in his mind, and it feels that he has a smaller organ, in spite of not understanding that he is at a younger age group. Relationship with others, fears and anxieties about penile size might also arise after breakdown of a relationship, or a casual encounter with a sexual partner, or a prostitutes, or friends with benefits kind of things in this modern generation. Usually in such situation, the partner have multiple experiences. So she might have an experience with a man with a well-endowed organ, and she might perceive that this present partner has a smaller organ and make a passing reference, "Arey, tera to chota hai." Now, for that partner, it's a small thing to make such comment. But this sticks into the mind of that male, and it's very common observation in the practice. Developmental issues for those men with poorly developed small testicles, the problem might be accentuated, and there is no upward or forward lift of the penis, and so genital bulge is minimal. Genital confidence can be impaired if there are small testicles, which I would show with a proper patient's organs. History of congenital abnormalities like hypospadiasis and epispadiasis. I have come across 3-4 cases. Hypospadiasis is pretty common, but epispadiasis 3-4 cases. Out of it, one particular case is completely epispadiasis. Entire frontal skin cover is missing, and a very short organ. So the first one is an infantile genitalia in a 28-year-old male. love marriage, but again, the wife was very accommodative, but this is what it is. There was hardly any erection which could be induced. And the second is the genuine micropenis. This is after trying to induce an erection with prostaglandin E1. And the third one is, you can say small, but working sexual activity was possible with that particular organ. And this particular individual, the Peyronie's disease, is a 72-year-old chap. He already had 2 wives, and he wanted to, from Middle East, probably a MNE national. He wanted to marry a third time. This time the bride was 25-year-old. And he said, this is how it is, and he never bothered about his diabetes. He ended up having multiple, over a long period of time, multiple plaques. Then you have small scrotal sac where the organ, penis is normal, but the scrotum sac is infantile. And this particular individual, I've never seen such grave, such huge and fungal infection. Psychiatric disorder, sexual dysfunction, and other factors play an important role. This is buried penis, where because of obesity, the penis appeared small, but it wasn't. Then this is an individual who had a complete hemicolectomy, and because of his multiple issues, he couldn't have an erection for a long time. I induced an erection with the help of prostaglandin E1, and he was almost 7.5, 8 inches. That is quite a big organ. And still, because he was not experiencing erection, he felt thus his organ has become small. So I demonstrated and convinced him that his organ is much more than what is needed actually. So symptoms, most men in our clinical practice are concerned about flaccid penis size. They describe feeling insecure, anxious, low in mood, display social phobia. There is increase in men concerned about erect penis size and who know they have a normal size. This is because of the internet bombarding of the private clinics offering length and girth enhancement. Societal influences do have a role. Impact of internet is pervasive, and it is less common for men to develop small penis syndrome in adulthood, but I have come across such cases. Assessment, clinical assessment is must, and main concern whether it is flaccid length or an erect length. Full medical, psychosexual, psychiatric history should be undertaken. Specific themes to be explored. General beliefs, values, assumptions, behaviors around genitals, sexuality should be inquired. How does this affect? What can be used? Can he use public toilets, and uresis is actually being done or not? Participates in athletic sports. Avoid meeting potential partner. Most men will have normal sex drive. Whether he avoids certain occupations. Psychological profile scores might be helpful to assess self-confidence, self-esteem, quality of life, social anxiety, and symptom distress. Examination should be thorough. Physical examination, genital examination, whether significant suprapubic fat is present or not. Careful measurements of length, girth. Endocrine abnormalities can cause true micropenis. As general assessment of secondary sexual characteristics is very important. Management, normalize and provide sexual education. Try to explain what is correct and what is within the framework of normal range. Mirror work, by patient observing himself in a full mirror, he might come to terms with what is normal. Then you have psychological therapies, particularly CBT, which has been covered by Dr. Kamaljeet. Physical treatments, those include vacuum devices, penile extenders, traction device, and perinoscrotal and penile rings. I have seen many qualified people promoting vacuum devices as a means to enlarge penis size, but it is not helpful. Evidence on their efficacy is very limited. Vacuum devices are used as a treatment for ED, but they are also promoted as a size extenders. So management options, again, you have medications, you give SSRIs, buspirone, you can give antipsychotics for the psychotic component. Then self-help sources, inevitably we all are used to searching the internet, but we have to understand that small, if at all it is small, not exactly small, but it is beautiful, and that smaller penis can be celebrated by both men and his partner. The Greeks and the Greco-Roman civilization, the sculptors have shown an average or not so well-endowed genitals. So that was the part of their culture, and I think that is perfectly okay. Management and treatment options, again, there are surgical options like suspensory ligament and enhancers and various other things. Large number of new surgical techniques have come, which I am not going to get into the details. Conclusion. Small penis syndrome is a distressing and invalidating syndrome. Professionals working in urology, andrology, surgery, psychiatry and sexual medicine should be aware of this. More research is required on the effects of race and age on penile length. Conservative approaches to therapy based on education and self-awareness are a must, along with CBT in severe psychological distressful cases. Of the physical treatments available, there is poorly documented evidence to support the use of penile extenders. More information is needed on outcomes with these devices. Similarly, dividing the suspensory ligament can increase the flaccid penile length. Limited data, just 2 minutes. Emerging data about effect of surgical treatment is necessary for giving the right recommendations to the patients. Working in a multidisciplinary team for assessment and treatment is highly recommended. Now these are all internet-based, there are no published data on this, but this is the size of organ as per the geography. They are, you can see the Negro race having the largest organs. Then we have certain recommendation. We have to take SPS seriously, and we have to do appropriate counseling, psychotherapy, treatment, or whatever is needed. Micropenis is hardly treatable, the real cases, whereas in Peyronie's disease, we can advise operations, but again that would lead to shortening of penis. Thank you.
Only 2 questions is allowed.
And we all need to remember that the vagina is designed to accommodate each and everything. Whatever cannot be accommodated, that is a genuine problem.
I invite Dr. Shakib Danish, sir, to felicitate Dr. Amit Mutha, sir.